Hi, today I'm going to be sharing with you a couple of different things about brain health. And I feel like there's so much talk about brain health and dementia and Alzheimer's and the different things that we have going on in our culture. And one of the things I think that isn't being talked about a lot is how chiropractic can help with brain health. And I know a lot of you, when you're coming to the chiropractor, you're coming to see me as a chiropractor, you're coming because you're hurting. So you have neck pain, back pain, headaches, joint pain, things like that. Some people come with, with anxiety or some other things going on, but typically pain is the biggest thing. What I think people don't know, and I'm really working on educating people, is when we're adjusting your joints, so anywhere, if it's your feet, your ankles, your knees, your hips, all that information, we're stimulating joints, and that stimulation helps support your brain and actually builds your brain and builds brain health. So the email I have out that's going out with this video, hopefully the information in there is going to be helpful. I don't want to go into it too much on the video because I only have a certain amount of time on the video and you only have probably a certain amount of attention span. But I know videos are kind of easier than reading, so I just wanted to take a minute and talk with you about that. I used the example of a knee in my email that I put out. So when we're adjusting the knee as a chiropractor, we're looking to see where the joints are misaligned, because when there's a misalignment, that means the information from the knee joint where it's misaligned is kind of getting muffled all the way up to the brain. And I use the example of when you play the game telephone when you're at a party, and the first person in the row says something like, "I like ice cream." And if you have 10 people and they're all whispering it, by the 10th person, the person will say, and you're supposed to say what the person said. And he's like, "I went out to the store yesterday." So it's completely different at the end of the line. And it's always like a fun party game. But that happens in our bodies also. So if you have your knee and you have nervous system information all the way up to your brain, it's supposed to go from your knee up through your thigh, your hip, up into your lower back, your middle back, your neck, and up to your brain. But you have that game of telephone happening. So if you have interference, if you have joint misalignment along the way in your knee, your hip, and almost everybody I touch, even little babies, have bones that are out of place. And so if we don't have that movement in there, we don't have that proprioception, that nervous impulse going up to brain, your brain's not getting the information. Instead of saying the knee saying, "Hey, I'm hurting," or "This muscle needs to work," the brain's maybe hearing like, "This muscle's kind of working, but I don't know which one. I don't know what you need to be doing for it." So the point with all this is when you get adjusted, it really helps to align those joints. So what I really try to encourage people, and all of you, and if you don't live near me, that's fine too, go find a good chiropractor in your area, get those joints adjusted so that they're in alignment, and then go move. Moving is the next best thing. And when people tell me, they ask me like, "What can I do at home?" Like, first get adjusted, because if you're moving a joint, I tell people it's like if you put a rubber band around your finger and you're like, "Okay, I'm going to move it," and you move it, but then your finger's purple and there's not enough circulation in there, then you can move it, but it's not going to help make the muscle stronger because there's no blood supply in there. So when we're doing that, when we're adjusting you, all the chiropractors out in the world, when we're adjusting you, it's like we're taking the rubber band off the finger. So now you can go exercise it and you have good blood flow and good nerve supply in there. So I tell my patients, once you get adjusted, move. Even if you're in pain, even just moving your fingers like this, if that's all you can do, because some people are in a lot of pain and sometimes it's been chronic and it's hard. Even as chiropractors, you're getting massage, acupuncture, all the different kinds of body work, PT, like sometimes things don't really get better and we're just trying to maintain, but you still need to move, even if you can't get up and walk or do yoga or swim or mountain bike, whatever it is. But everybody can move their fingers and everybody can rotate their wrists. You can move your elbows. You can do something with your neck. Usually you can breathe. When you breathe, it also brings oxygen to your muscles and that helps open up your joints also. So breath. And I tell everybody, I'm gonna bring my foot up here. So even if you're rotating your ankles, bending your toes, moving your knees, if you're even sitting in a chair, you can do all of this and it helps stimulate your brain, because if your brain's not stimulated, it starts getting mushy. I'm not saying that. Sorry, that's metaphorical and that could be offensive to people. So I'm really sorry about that. But the brain doesn't get the stimulation. It needs stimulation, it needs oxygen, it needs nutrients, and it needs movement. So when we're adjusting as chiropractors, we're getting that movement in there, we're stimulating the joints, but they're also stimulating the brain. And then you can do that at home also, moving your joints. So that's my message for today. Keep moving and then get adjusted. It's super important. I always try to help people and say, no, it's okay. You don't need to come get adjusted, because I know time, money, and energy is a big thing for everybody, but everybody can get adjusted once a month. So do that for yourself. If it's me or if it's somebody else, whoever it is, take care of yourself. Okay. Thanks for listening. Great to see you guys. Bye.